Okay, so to start the exam, I've already seen Scott walk, and his gait is pretty normal. We've already gone through some squatting and some single leg squatting, and he has pretty symmetric leg strength. So throughout these last few weeks, as this has been hurting, I would say good job to Scott for keeping his legs strong. So the first thing I do is to just kind of move his hips to make sure his hips move symmetrically and the pain is not being referred. I watched his face. It didn't seem as if he had any soreness when I did that, so I'm pretty sure it's not referred pain from his hip. So then next thing I'm going to do is feel his joint line, because remember the meniscus sits right here, right below the inferior pole of the patella, which is here, right down there. And so I'm going to palpate along or push along his joint line to see. So there's the inferior pole of his patella, and I am pushing along his joint line here to see if that's where he's sore.
Right there.
And he's kind of wincing there and telling me that his soreness is right there. And it's interesting that his soreness is there, and that's a very common place to have symptoms with a meniscus tear, right there. So what oftentimes happens is, if this is a meniscus, so this would be Scott's meniscus like this, the front and the back. I'm just going to flip it over this way. And what happens is you get a little tear like this. And if you notice, Scott said that sometimes it feels better than other times. So it hurts right there at the joint because that's where the tear is. So this little torn piece right here, and I hope you can see that, but that torn piece right there gets tugged and it pulls on the capsule there. The meniscus itself does not have any innervation, so the meniscus itself doesn't hurt. But what hurts is when this piece tugs and pulls against the capsule here, and that's where it hurts because that is right where that piece is still attached. So what happens is that piece could get displaced and be flipping around in the joint, and those are the days it hurts. When he's able to get it reduced so it just sits there like it does normally, then it doesn't cause pain. Then all of a sudden it'll get displaced again and it'll start tugging. So now we're going to do some more provocative testing to see if it really does that. And what I'm trying to do with our testing is to find that piece and grab it and pull it to see if that's where it hurts. So whenever I examine somebody, remember it's this knee, I first check to see if they have symmetric hyperextension. So I check his right leg, and he goes up probably about 4 or 5 degrees. I check his left leg, the symptomatic leg, and again it goes up about 4 or 5 degrees. I then check for swelling, so I get Scott to relax here, and I do what's called a fluid wave. So I sweep the fluid, if he has fluid, in his knee from his medial gutter over the top, and then I push back, and he does have a little bit of swelling in his knee. So again, people with a meniscus tear would get swelling in their knee. So I'm thinking, maybe he does have some pain from his meniscus tear. Then I rule out other things like patellofemoral pain. So I push up under his patella. That doesn't seem to hurt. I do a compression test where I take his patella here, I'm capturing it and mashing it in his knee. And again, that doesn't hurt him. So referred pain from his kneecap is probably not the issue. So I'm going to then do a quick ligament exam. So this is just a quick Lawless exam to make sure his ACL is working, and that's fine. Then I'm going to check his collateral ligaments, his medial and lateral collateral, and those feel good. And I'm going to bend him up, and I'm going to confirm that that's where he's sore. So I'm going to push over here on the outside of his knee first, and he doesn't really seem to have much soreness over there. Then I'm going to push on the inside of his knee, and that's where he starts nodding and grimacing because I'm getting to the sore spot. And again, I'm right at the inferior pole, I'm right at the mid portion of his meniscus. So now I'm going to do what's called a Mcmurray exam. So what I'm doing is I'm trying to catch that piece of meniscus and see if I can pinch it and make it hurt. So I'm flexing him. Right now I have him internally rotated. I'm going to externally rotate it and extend him. And you can see how he's grimacing here. Where did that hurt?
Same spot.
Same spot, so right there.
Yeah.
So that's called a Mcmurray exam. And sometimes, sorry Scott, I'm going to do it again, you can feel a little catching or clicking with this. And I do feel a little catching right there. Not much, but he certainly has symptoms with that, sorry. Essentially, I have confirmed that he does indeed have a meniscus tear. His history is very concerning for one, and his exam is concerning. He has swelling, he has joint line tenderness, he has a positive Mcmurray. If you liked this video and found it informative and would like to have further information, please check out our YouTube channel, as we have many informative videos there. Please also subscribe to our video channel and you'll get weekly updates with new information.